Hello everyone and welcome back. This is Yusuf
And this is Tamila.
and we welcome again to the Health Innovation Playground. Today is a very special day because it's our first episode and we have a very special person here.
Yes, Josep Antoni Quiroga, specialist in psychiatry, correct?
Yes.
And medical psychology, right?
Yeah, with a PhD and head of Psychiatry Unit at Vall Hospital and the president of Commission of Innovation at Vall and also the coordinator of our Masters in Health Innovation and Entrepreneurship.
Exactly, and seems like a very good person.
Thank you so much for the invitation to be here and also the position of the Autonomous University. I am professor of the Autonomous University in Barcelona and the co-director of the Masters in Health Innovation and Entrepreneurship. I'm very happy because we are in front of two of the most innovative people in our Masters, and very happy to collaborate with you with this awesome podcast.
Thank you. So we're gonna start with the question directly because we are very curious students. So the first part we're gonna define
Yeah, like when I started this master, I say Masters in Health Innovation and I tried to explain this in a lot of ways, but how would you explain this to someone?
Yeah. Good question, because it's why we are doing that and why you thought on these masters, of the needs of these masters. There are a lot of formation education in postgraduate education in terms of innovation, in industry innovation and in other areas. But in health, the idea of to promote innovation and in health and to have absolutely clear in mind what is all the procedures of innovation, the different steps, the methodologies, the needs that we have, and also to get more than this general information, to go to the entrepreneurship, to have the capacity, why not, to build your own startup, to build your own company, and if not, to know all around this, because we advise and we foresee the idea that all of your as students can have the possibilities to develop this financial economic plan, and also all of these ideas to be on the market for helping people. Yes, and that is a need that we have here in Spain. Obviously, there are more health innovations masters around the world, but we thought that it's specifically in our context, Barcelona is a very, very important hub on innovation, a hub of new technologies, and we thought that this master covers a need that we have specifically in health here in Spain, but also with this international perspective. And you are an excellent example. People from Middle West, people from Asia, anything. We are very happy to have this picture of international master from United States, from Europe, Asia, Africa, in any place, anywhere.
Like the first part, you explained it so good. So let's.
I have a question.
Yeah, sure.
In your point of view, what is innovation?
Absolutely clear. Innovation is not to improve only. Innovation is to develop new ideas, to develop new processors, to develop new products to the market that cover needs. Yes. Mm-hmm. And the beginning of all of that is the need. We have needs not well covered in terms, in this case, of health. And we develop a change of paradigm, a change of way to do. And we develop product or a process to get onto the market, to, in this case, to change the way that we are doing. But the bedrock, the basis is we have a need. We have aspects not well covered with the solutions that we have at that moment.
Would you say it's a science or an art?
Well, science and art are together because when we are carry out, for example, new projects of investigation, of research, or it's absolutely critical to have the creativity, uh, to get solutions for these health problems, but also, obviously, related with the science, with the knowledge that we have or the knowledge that we can develop. But it's a mixture. We need creativity in science, but also creativity in this case. And as you had the opportunity to see during the masters, there are some specific methodologies for innovation, and one of them that I like it is the design thinking. And in design thinking, it's absolutely clear this idea of creativity and also the work together with people with different profile more than the scientific profile. Yes, designers or anthropologists or philosophers, anything.
Background.
Absolutely.
Master one more or
Yeah.
less health, right?
Our idea when we developed this master was to be focusing people with background and knowledge on health, obviously, but also for us is very important people that are working in an area of business to get information about what is the areas of health that we need to put more efforts in terms of innovation, what is the needs that we have in health, and also the methodology, because they know or they need to know what is the in order to assess what project I invest my efforts or not, what is the methodologies, what is the project with a good structure behind.
Yeah. Why now?
Well, that is also one of the critical situations. Why to do this master now? Because we are in front of us in a absolutely revolution in the way to do health. The transformation with AI will be tremendous for health, the impact on the way to do, but also this AI that we will use or these new paradigms, we need these structures of the methodology of innovation. As you remember, the main part of the projects, the startups that is started in terms of innovation, the main part of the failures is because they are not based in needs. Mm-hmm. And that is that these companies or these startups, they didn't have a good process of innovation because in the bedrock of innovation is needs.
I would like to pivot on, we're always talking about how is it different from why do we need this?
Well, in terms of a public perspective, as you said before, I am a psychiatrist in a public hospital, public hospital, and for us, the mentality is to perform new procedures, new ways to treat patients, but with this public perspective to maintain the sustainability of the system. If we don't have this idea of the whole system together in this quintuple aim that always I am saying about this idea, the right innovation is the innovation that take care of these quintuple aims. And in this case, it's absolutely critical. Time ago, maybe the result was to reduce the cost of the intervention or to be absolutely with high efficacy, but not to have this holistic perspective of these different points of this pole star, yes, of the quintuple aim.
What's the quintuple aim?
Wow, good question. You are excellent students of the master. The quintuple aim was a concept that started years ago during the 2000 with the idea of the value of measure the outcomes that we have. This from Harvard with Michael Porter, and later on was developed this idea of the triple aim to have not only these results of the outcomes, to have the experience of patients, and also to have the best solutions in terms of cost efficacy. Yeah. Later on, we need to incorporate also not only this the patient experience, yes, but also the experience of the professionals of health taking care about the burden. And also later on for us it's absolutely clear this quintuple part is the equity, and maybe this equity will be if we think about equity, we will have all of these four parts taken together: experience of patients, experience of professionals, best health results, and also in a good terms of low cost with the best results in health. And that is the quintuple aim.
Professional and the patients also?
It's absolutely clear. I am working as a professional in mental health, specifically in psychiatry, from 2001 as a senior. And over this year, we, for example, take advantage of all the measure of outcomes to be absolutely close to patients and to develop together, to work together with patients, new procedures at the hospital. Obviously, at the very beginning, the idea of the cost of the interventions was under the table, yes. But more and more also the experience of patients is absolutely critical. Equity, maybe in this case, we can promote project at the hospital, but also we need in this case this political perspective. Yes, in some cases to promote the equity in health is not to promote a better drug treatment or better psychological treatment. Maybe it's to promote to have a home or another resources, and in this case, it's more than the health. The health management, but it's absolutely necessary that we push to the political authorities to take care with this concept. I am working at the Vall Hospital, and we have a specific area of processes working with this perspective, yes, and also engineering working with us. And in this case, it's a very specific hospital. For the dimensions, it's a hospital with more than 1,100 beds, and also with 1,011 professionals working together. It's a tertiary care hospital.
Like for you as a professional and specialist in psychiatry, what is the latest innovation in your area, in the area of psychiatry in Vall, or maybe what example would you give, like a good example of innovation that was implemented in mental health area?
Okay. Now, for example, in general, globally in psychiatry, one of the aspects that we need to improve is to have complementary tests to diagnosis of disorders. Over the last years, for example, one of the, I think, interesting aspects of innovation is the implementation for example, the bipolar depression, to use microRNA to the diagnosis of bipolar depression. That is another that we are working, and that moment is not implemented, but we are working on that, is to develop models for speech recognition and to improve the diagnosis of depression in the primary care settings. Yes, it's part of the innovation that we are running together with Accessible, that is a company that is running this model. Yeah. And it's not very new, it's with years ago, but one aspect that changed also the way to do the treatments in psychiatry also was with virtual reality. More and more is possible to do treatments at home, not at the hospital, and to treat phobias or to treat other anxiety disorders. And that is an important part.
And in simple terms, how would this translate to the patient? How would the patient feel the difference, or feel that mental health now is more accessible?
That is one of the challenges that we have. There are a lot of new results in terms of what is the best treatment for schizophrenia or ways to do in a different way. Yeah. And the challenge that we have is that in every place, in every setting, not only in the university hospital, in community centers, could be possible to have access of these new treatments or access of the newest knowledge. Yes. For example, we know that people under treatment with long acting antipsychotics, they have better results in terms of health in general, and that is the challenge that we have to get access to this treatment for the people that need, or the access to treatments like ketamine intranasal. Yeah. And that is the challenge that we have as clinicians and also leaders of the hospitals or the healthcare centers, to promote the access of these innovations in terms of therapies.
And how would these new innovations help you overcome these challenges?
For example, in the case of all of the research that is now running about new biomarkers, or to find biomarkers in psychiatry, that will have a tremendous change in psychiatry, because we will have in the next year the possibility to have the clinical aspects, the interview with patient, that always is absolutely important, but also to have this complementary test to improve the diagnosis, but also to personalize the next treatment. Some patients with a specific genetic profile deserve one drug or another drug, and that is the point. Very similar that in other areas as oncology or neurology they are running, and that is I hope the next future that we will have in psychiatry and mental health.
And with biomarkers, I guess it should be very fast, because with the waiting list, it's also one of the problem of the hospital, public hospital now, that you have a big waiting list, or you already found a solution?
No, we have waiting lists like in another centers. It's not one of the
big problem
we have in this sense good results. Yes. But that is one of the challenges of mental health, because across lifespan, around 20-25% of the population will develop or will have mental disorder. And we need to improve ways to get access in a fast manner, for example, for mild and moderate conditions. Yes. And now, for example, with digital health, could be possible to reduce the waiting list in not this very severe people, and to focus more to severe people in physical appointments, and to do with digital health this medium or mild or moderate severity symptoms.
I would like to simplify a little bit for the listeners how I would imagine mental health could change in the next few years. So the biomarker thing, what I understand is the patient will have a consultoria or a visit with the doctor, like always with psychiatry, but the new shift that we will be able to make a blood test, for example, and get this biomarker to diagnose if they have a certain psychiatric disease, for example, schizophrenia.
We can dream.
We can dream, yeah?
We can dream. One dream could be, for example, as I said before, digital health. Almost all the people have a smartphone, yes? And also, there are a lot of people also working on to understand better the outcomes of several activities of the smartphone in terms to predict diagnosis or not, yes, and also to predict evolution. Why not in the next future we can have a solution that can put a prediction of symptoms of depression, anxiety, blah, 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 in function of the use of the variables that your smartphone are getting in a passive way.
Yeah.
That information could be combined with a simple test that you can do in the digital applications.
Mm-hmm.
Also, if the symptoms are with high intensity with the physical appointment, we can have later on these possibilities of biomarkers, yes. But also for mild and moderate, to get access very quick, very fast to these digital health treatments by yourself, and if not, to combine with other. Why not neuromodulation that we can have in specific areas of the brain externally with magnetism, electricity, and that we can control with devices. Yes.
Mm-hmm.
Now there are a lot of research with deep brain stimulation, but imagine a system that we can stimulate without this necessity of surgical intervention in the next future. Why not?
For example, I would imagine that the smartphones and wearables would track the pattern of walking, the patterns of sleeping, how much time I spend on
that is
social
absolutely
media.
Possible today, and to combine and to have prediction about is it depression, is anxiety, yes. Also the pictures that all of us we are up onto the Instagram or other applications can predict what is your feel, your mood.
Mm-hmm. Like, you were always a psychiatrist. When did you think, oh, I want to switch to health innovation? I think you also did the PhD in innovation in Stanford.
Yeah, in health. I was doing a master's on health, e-health, management of health, and around this postgraduate in design thinking in Stanford in a summer. And I think it's not a different way or a different perspective. I am a clinician, a researcher, and to me it's absolutely essential to get access to know all of this methodology of innovation, because it's the way to promote innovation in my field. I think it's not a different track or a different topic. I think it's an intensification of your research or your passion to perform or your passion to change things. Yeah. And innovation is that. This is opportunity. If you have a good knowledge on innovation with education, I think it's more visible that you can promote changes around you in your professional area.
Yes, and you should be very open-minded to introduce it, in the area which can have resistance, to change, as we were talking about also in class, that you really need to know how to deliver the new ideas to people who are not or afraid of innovation.
Yeah, Camila, that is absolutely true. And for that, in your master's, you have a mother about this communication, about these soft skills. Innovation is innovation in team and innovation with other people, together with other people, for other people. Yeah. And in this case, we need to deal with the resistance of change, to understand why people, for the people it's complicated or not easy to change.
Yes.
Yeah. The insecurity, afraid, but it's absolutely possible to manage. And also, if we have good basis for one specific project in terms of innovation, maybe it would be better for people to understand why we are changing. If we have not clear ideas, objectives, missions, maybe it could be difficult to explain to the other people and to try to not to convince, to engage people with your project.
Mm-hmm. And this master's, we are now sitting in a hospital in a big campus. Why does it matter that this master is physically inside a hospital and a research center like Vall d'Hebron?
I love this question, Josep, because it's one of the values. You got the opportunity to be in touch with international leaders in health, in oncology, neurology, pediatricians, cardiology, anyway. And maybe you could understand what is all of these processes of innovations with this absolutely close to the bed of the patients, with the needs that we have, and also you had during the classes of the masters the possibility to know people who develop their own company, their own startup. What is the difficulties? I think it's quite different to have these kind of masters in a place not absolutely connected with the real needs of the people or the health. In this case, what is that one of the values of our campus, to have the connection of the hospital, the day by day with the people that we try to resolve the health issues, together with researchers, with innovators, yes, but also with the expertise of the university, professors of the business school,
Yeah. And Vall d'Hebron is part of an entire ecosystem here in Barcelona. As a proud Catalonian and Barcelonian, why Barcelona? Why is it a hub? How rich is it at?
Well, it's a nice question, Josep. We are here at my office, and in my office is a picture of Picasso. And maybe that is a good example why in Barcelona was one of the first places of Picasso before to move to Paris, as you know. Barcelona, historically, we are a hub of innovation in terms of arts, innovation in terms of medicine, innovation in technology. We are the hub, as you know, the Mobile World Capital Congress. It's nowadays is an important hub of innovation related to health. More and more important companies are coming to Barcelona, and specifically, for example, our center doing clinical trials, research. You know very well the dates, and it's every year we have more than 1,500, 1,500 clinical trials every year in this campus. And that means that it's a city that in general loves the innovation, the changes, the new ideas. We are absolutely connected with the rest of the world, and we're a mixture of identities, a mixture of culturalities, and we love these cocktails. And innovation is a specific set of this combination of people from different areas, because it's when we get the best of everyone.
And you think this is pushed by the government or created by the government or the people?
I prefer to think that this is a bottom-up trajectory in terms of innovation in general. But it's true, absolutely true, that over the last years or decade, we had here a political perspective that is not the future, it's the present of the Catalonia, and also specifically the city, Barcelona. And there is a set of institutions, governmental institutions working with this perspective. And it's the best situation in terms of that is to have a government with a clear idea implication to promote innovation, and also to have an ecosystem with people very active and to go beyond and to work together. Yes, and in this sense, I think it's this good combination that we have now. And in general, as you know, Catalonia in the benchmarking of the other areas of knowledge around Europe, we are getting better positions. Yeah, but it's not enough to be in our position. We foresee to be on the top 3. Yeah? And that is the
Yes,
idea.
and it's good that this healthy competitiveness.
And also we have the culture. And in Catalonia, in Barcelona, as you can experiment here during the last years, we have a rich culture in every sense.
And you have the beach.
In the mountain.
Absolutely.
Yes, that's really
culture
nice.
and nature.
Yeah, like I wanted to know, not everyone wants to quit their job to become entrepreneurships, or can someone, clinicians, innovate without leaving the hospital? Or they need to quit the job or quit being a doctor to become...
Joseph, that is a critical question. It's not easy to maintain some time to work together, to be clinicians in a hospital, in a community center, and also to try to develop a startup, a company, and a spin-off. Yes, it's not easy. I think that is critical. All of the support you have in your institution. In this case, why we are the center in Spain with more spin-offs over the year, because in this case we have a good structure in terms of the Innovation Unit of the Vall Institute of Research, and that is critical. Yes, the Research Institute is our arm to promote this transition from the ideas in the hospital to final solutions in the market, and to having this work together with them is possible, is feasible. We have a lot of cases that they can maintain both activities.
And why would you think that some startups could fail in achieving that? What are the difficulties or the challenges or the things they miss?
As I said before, I think it's very important to think and receive what is the need that you can resolve. The majority of them is not a real need. Yeah? Mm-hmm. In some cases, we develop needs because the technology can improve, but it's not a real need. It's not a need of, in this case, of patients, people living with disorders. That is one. The other is, in some moments, the context could be absolutely different and against you, and you can manage this context, but it's a question that you need to take care. And the other, I think it's very, very important, these parts of the soft skills, the management with your team, the management, and why, the motivation, why to develop, why to do, why to perform. Yeah. Without this motivation, it's absolutely impossible to do anything in life, but to develop a spin-off, to develop a startup, it's a hard work. It's not absolutely linear work. Mm-hmm. It's with come and back, changes, new challenge. Yeah. Mm-hmm. But with this motivation, with a clear vision, a clear mission, it's absolutely possible.
Mm-hmm. Yes, and in 5 years, what do you see? Like now, it's I don't know this term, the sleeping giant, no?
Yeah.
Of innovation. That in 5 years, you think it's going to explode?
Well, one of the challenges that we have is that the current changes in terms of innovation, in terms of technology, are absolutely fast if you compare with years ago. Now 5 years maybe is like 20 years. Yes.
Yes.
In 10 years ago, we started to talk about the social media networks in 2010, and now is terrible the explosion on AI was very recent to talk
Yes,
about
true.
solutions that all of you know, ChatGPT, Gemini, and in 5 years will be a tremendous change, I think, in terms of AI. AI will have a dramatic change. I know that now people are talking about the bubble. The bubble is by the economic.
Yeah.
To get access, to gain more money, to have good results in terms of the business. That is one side, one part. But the change in the way to do is being tremendous. The way to do, for example, the learning. To ask homework for people to develop. We need a different way to do it. And maybe we can return to more classical face-to-face text or presentations, as you remember in our masters. Showroom.
Can you paint a picture of this future of healthcare in 5 years, maybe?
Wow. It's interesting. For private healthcare, the impact of artificial intelligence, AI, could be tremendous because they have the economic muscle to introduce the changes now. In public health system, we need to put money to introduce all of these changes. And maybe we don't have immediately these changes because it's necessary an important investment at the very beginning. And now we are in a very difficult moment, in terms of the economic investment for the public health. We need to think more in public health because it's the way to promote the equity. But for example, I put examples of here. Biopsies in Vall d'Hebron. Now we have an AI that is doing the diagnosis, or for some other explorations in terms of ERX. It's possible to have the diagnosis with AI. Or maybe in the screening of some pathologies at the emergencies room will be visible to do. But I imagine that we have more resources to help doctors to spend less time doing reports, to have more quick access to the results of these diagnosis, for image diagnosis or biopsies with diagnosis.
Make our lives easier and for the patients as well.
Yes, exactly.
I think one last question. What would be the first piece of advice you would give to a clinician or a nurse listening to us right now who has an idea to improve health but doesn't know where to start?
Education, learning. I think it's very important to have the methodology, the methods, and that is absolutely important. To have access a good master, postgraduate, in terms to have the basis to do this development and new research on new ideas. And also work to develop a team. Maybe you don't have a specific knowledge on AI or knowledge on deep learning, but you can have people around you working with that and to develop team and to take the best of each one of these teams. But it's absolutely why I'm now doing more research in digital health, because I had this master of health or education on innovation, and I think that is important to have the right information and the education on that.
In multidisciplinary team, no? As not afraid to share information.
Health is multidisciplinarity by definition. And now it's absolutely
yes, absolutely normalized now to share your knowledge with everyone, to
seek work together. All of the different people of the hospital. Maybe the experience of a patient will not depend only on the contact with doctor, and depend the contact with the nurse auxiliaries, or depend the contact with people working and the clean service of the hospital. All of us, we are a team and we work together.
Well, thank you very much.
No, thank you.
It was an amazing session.
It's a perfect day. We thank you so much for the support in launching this podcast and for always inspiring us and being such a great mentor.
And thanks, to this master and your big work with your team. We actually made this happen. We met on a master class, and this is how it began.
To all of you, both because you have passion and you want to go beyond, and that is very exciting also for all of us. Thank you.
Thank you.
See you soon.
Bye.
And we'd like to thank everyone listening to us. Thank you for being here on our first episode. And we wish you listen to us soon.
Yeah.